Understanding the pressure within. What is low blood pressure? Low blood pressure can also be a cause for concern. It can be a sign that your body isn't getting enough blood flow. This can lead to symptoms like dizziness, fatigue, fainting, and confusion. Blood pressure is the force exerted by the blood against the walls of your blood vessels. When this pressure is too low, your organs may not receive the vital resources they need. Decoding the numbers. What does low blood pressure look like? So, what exactly qualifies as low blood pressure? In medical terms, it's referred to as hypotension. Blood pressure is measured in millimeters of mercury, mmHg, and is represented by two numbers, systolic and diastolic. The top number, systolic pressure, measures the pressure in your arteries when your heart beats and pumps blood out. The bottom number, diastolic pressure, measures the pressure in your arteries when your heart is at rest between beats. For most adults, a normal blood pressure reading is below 120/80 mmHg. Hypotension, on the other hand, is typically defined as a reading of 90/60 mmHg or lower. It's important to note that these numbers are just guidelines. What's considered low blood pressure for one person may be normal for another. That's why it's always best to consult with your healthcare provider to determine what's healthy for you. A silent siren. Why understanding hypotension matters. Low blood pressure can often go unnoticed, lurking beneath the surface without causing any noticeable symptoms. This is why it's often called a silent condition. However, even in the absence of obvious signs, hypotension can still have implications for your well-being. For some individuals, low blood pressure is a normal physiological state and doesn't pose any health risks. However, for others, it can be a red flag signaling an underlying medical condition that requires attention. Think of it like a car's dashboard warning light. While a flickering light may not immediately cause the car to break down, it's a clear indication that something needs to be checked. Ignoring it could lead to more serious problems down the road. Understanding hypotension empowers us to be proactive about our health. By paying attention to our bodies and seeking medical advice when needed, we can address any potential issues before they escalate. When your body doesn't get enough fluids. Dehydration and low blood pressure. One of the most common causes of low blood pressure is dehydration. When your body loses more fluids than it takes in, your blood volume can decrease, leading to a drop in blood pressure. Imagine your blood vessels as a series of interconnected canals. When you're dehydrated, it's like the water level in those canals has dropped, reducing the pressure within the system. This can happen for various reasons, such as sweating excessively from exercise or hot weather, experiencing vomiting or diarrhea, or simply not drinking enough fluids throughout the day. The good news is that dehydration-induced hypotension is often easily reversible. By replenishing your fluids through water, electrolyte-rich drinks, or intravenous fluids in more severe cases, you can restore your blood volume and bring your blood pressure back up to a healthy level. Section 5. The engine room needs attention, heart problems, and their impact. Just like a car engine needs to be in top shape to power the vehicle, our hearts need to function properly to maintain healthy blood pressure. When the heart is unable to pump blood effectively, it can lead to a drop in blood pressure. One such condition is bradycardia, a slow heart rate that can result in inadequate blood flow. Another is heart valve problems, where the valves that regulate blood flow in and out of the heart aren't working as they should. Heart attack, a blockage of blood flow to the heart muscle, can also damage the heart's pumping ability. Addressing heart-related causes of hypotension requires a comprehensive approach tailored to the specific condition. Medications to regulate heart rhythm, surgical procedures to repair or replace damaged valves, or lifestyle changes to improve heart health may be recommended. It's important to remember that the heart is a vital organ, and any concerns about its health should be promptly addressed by a qualified medical professional. Section 6. The hormone messengers, endocrine issues, and blood pressure fluctuations. Our endocrine system, a complex network of glands that produce and release hormones, plays a crucial role in regulating various bodily functions, including blood pressure. When these hormonal messengers are out of balance, it can impact blood pressure levels. One such example is adrenal insufficiency, a condition where the adrenal glands don't produce enough cortisol, a hormone that helps regulate blood pressure. Another is low blood sugar or hypoglycemia, which can occur in people with diabetes and can lead to a drop in blood pressure. Imagine your hormones as conductors in an orchestra, each playing a specific role in maintaining harmony. When one or more conductors are out of sync, the entire performance can be affected. Treating endocrine-related hypotension involves addressing the underlying hormonal imbalance. This may involve medications to replace deficient hormones, lifestyle modifications to manage blood sugar levels, or other interventions specific to the diagnosed condition. Working closely with an endocrinologist, a doctor specializing in hormone disorders, is essential for effectively managing these complex cases. Section 7. Battling unseen invaders, severe infections and their toll. When our bodies are fighting off infections, especially severe ones, our immune system mounts a powerful response. While this response is crucial for eliminating the infection, it can sometimes lead to a drop in blood pressure. This drop, known as septic shock, occurs when the infection triggers a cascade of events that cause blood vessels to dilate and leak fluid. The resulting decrease in blood volume can lead to a dangerous drop in blood pressure. Imagine your circulatory system as a network of pipes. During septic shock, it's as if some of these pipes have sprung leaks, causing the pressure within the system to plummet. Septic shock is a medical emergency that requires immediate attention. Treatment typically involves intravenous fluids to restore blood volume, medications to raise blood pressure, and antibiotics to fight the underlying infection. Prompt medical intervention is crucial for improving the chances of recovery from this life-threatening condition. Section 8. The ebbing tide of life, blood loss, and its consequences. It's no surprise that significant blood loss can lead to a drop in blood pressure. After all, blood volume plays a vital role in maintaining pressure within our circulatory system. This blood loss can result from external injuries, such as deep cuts or gunshot wounds, or internal bleeding, such as a ruptured aneurysm or gastrointestinal bleeding. Think of it like a bucket with a hole in it. As blood leaks out, the overall volume decreases, causing the pressure inside to drop. The severity of the hypotension depends on the amount of blood lost. In severe cases, emergency measures are required to control the bleeding, such as surgery or blood transfusions to restore blood volume and stabilize blood pressure. Time is of the essence in these situations, as prompt medical attention can be life-saving. Section 9. Building blocks of health nutrient deficiencies and their role. Believe it or not, even nutritional deficiencies can contribute to low blood pressure. Our bodies require a delicate balance of vitamins and minerals to function correctly, and a deficiency in certain nutrients can disrupt this balance, impacting blood pressure regulation. For instance, a deficiency in vitamin B12, which is essential for red blood cell production, can lead to anemia, a condition where there aren't enough healthy red blood cells to carry oxygen throughout the body. This can result in fatigue, weakness, and low blood pressure. Similarly, iron deficiency, another common nutritional deficiency, can also cause anemia and contribute to hypotension. It's like trying to build a house without enough bricks and mortar. Without the necessary building blocks, the structure becomes weak and unstable. Addressing nutrient deficiencies often involves dietary changes to include more nutrient-rich foods or supplements to replenish depleted levels. Section 10. A double-edged sword. Medications and their influence on blood pressure. While medications are designed to treat various health conditions, some can have the unintended side effect of lowering blood pressure. Diuretics, for example, are commonly prescribed to treat high blood pressure by helping the body get rid of excess fluids. However, in some cases, they can lower blood pressure too much, leading to hypotension. Certain heart medications, such as beta blockers and calcium channel blockers, can also cause a drop in blood pressure as a side effect. These medications work by relaxing blood vessels and slowing the heart rate, which can sometimes lead to hypotension. It's like using a hose with a spray nozzle. While the hose itself delivers water, adjusting the nozzle can alter the pressure and flow. If you suspect that a medication you're taking is causing low blood pressure, it's essential to talk to your doctor. They may adjust the dosage, switch you to a different medication, or recommend other strategies to manage the side effects. Section 11. Taking control. Tips for managing low blood pressure. Now that we've explored the causes of low blood pressure, let's discuss some practical tips. 1. Stay hydrated. Our bodies thrive on proper hydration. Drink plenty of fluids, especially water and electrolyte-rich beverages. 2. Eat a balanced diet. Fuel your body with nutrient-rich foods. These provide essential vitamins and minerals. 3. Get moving. Regular physical activity benefits blood pressure regulation. Engage in activities you enjoy. 4. Elevate your legs. If you feel dizzy, elevate your legs. This helps improve blood flow to the brain. Talk to your doctor. Consult your healthcare provider for persistent symptoms. By taking a proactive approach, you can manage this condition and maintain your well-being.